Happy to be back here again. I believe this is week 15. Excited about these Facebook Live videos and just adding more value to people here in the community. My name is Todd Thoughton from Thoughton Physical Therapy, and I've been a physical therapist for over 25 years. My passion is just helping people. My passion is adding more value to people. My passion is also using the mindset piece to help people along to break through the physical therapy barriers that they may have to reach their ultimate goal. My idea with doing Facebook Live is I wanted to have a broader reach. I wanted to have a bigger reach with people than I had had before by treating patients here in the clinic. So if you have any questions about physical therapy, you can always reach out to me at toddh@thoughtonphysicaltherapy.com, and you can access the Facebook Live, our Facebook page, or you can just watch these videos to get some information. So tonight's topic happens to be one of my favorite topics involving the rotator cuff. How to recover from rotator cuff surgery successfully. You may be watching this for a few different reasons. One of them may be that you're considering to have rotator cuff surgery. The other one may be that you know friends or family that want to have the rotator cuff surgery as well. Or the third one is you've just had rotator cuff surgery. So I just want to go over some general anatomy that we have. So I'm going to grab my shoulder model. Hi Janet, how's it going? Haven't seen you in a while. Hi Devin, how's it going? Thanks again for joining. So we have the shoulder here. This would actually be a right shoulder. So this would be the humerus, which is the arm bone that comes down. This is the collarbone, which comes around to the front of your neck, right involved with your sternum. And this is your shoulder blade. So from the back side, this is your shoulder blade. So the rotator cuff is made up of 4 different muscles. One sits in the groove right here. Another one sits underneath the groove right here. A third one, and then one on the inside. So those 4 rotator cuff muscles, what they do is they, in general, keep the ball down away in the socket so the ball doesn't rise up and pinch, causing rotator cuff damage. So what I wanted to go over was basically there are different types of rotator cuff tears, and this will really have a big impact on how your recovery goes after surgery. The first one is acute tears. Acute tears can be small tears and they rarely get surgery. The next type is degenerative tears, where they're just simply worn out. It's kind of like if you had a piece of rope and over time the rope kind of frays and all of a sudden it might just give out. It might not be there might not be much healthy tissue to work with if you need to get one that's been a degenerative change over time. So we're going to break them into 3 different categories. We have a small tear, which is number 1, which is about 1 centimeter long. We have a medium tear, which is anywhere from 1 to about 5 centimeter. And then we have a large tear, which is anything above 5 centimeters. And then we also have complete tears. So for example, if we would look at it as one of the fibers might be a small tear, might be a medium tear, might be a large tear, where there's only one holding on by one fiber, and then we have a complete tear where it's being pulled apart. Hi Janet, how's it going? Thank you for joining. So the recovery is based on a few different variables. I think the number one issue that really will help you decide if you're going to have a really good recovery is your dedication. Your dedication pre-surgery, your dedication post-surgery. The second thing is what type of tear you had. Did you have a small tear? Did you have a medium tear? Or did you have a large tear? Another fact is how conservative or aggressive your surgeon is, and ultimately, how good is your surgeon? When you go into a surgeon, you want to make sure that you found someone that is really dedicated. A lot of orthopedic surgeons specialize in specific joints, so a lot of them will specialize in the shoulder. I would ask them to see any of their records, their surgical records, their risk for infection records, because these are all things that physicians keep track of. I would ask him if you could maybe talk with any one of his past clients. I really find a lot of information. Another thing you can also do is you can also kind of Just ask them questions about their personal lives. How are they as a person? What is their mindset like as a person? Are they really interested, or do they really understand what your goal is going to be? If you want to get back to playing golf, but if they don't like golf, then that maybe might not be a big fit, as an example. Next part is having a successful recovery. Your personal drive and your dedication, your commitment is huge. Hi, Devin, I agree with you. Your personal drive, your dedication, and your commitment, your willingness to put your recovery number one. It has to be number one. I see this happening all the time where people say, well, I'm going to really work hard. I'm going to really try and get my exercises done. That's really not going to cut it. What you put in is what you're going to get out. You really need to take the appropriate time out of work. If you don't have enough time out of work, your body really can't heal. One of the things that I've noticed is if you go, even if you have a desk job, you may be able to go back to work with your arm in a sling. What happens is the mental strain that puts on your body and the stress that's related to the stress can definitely cause, it can take away from the healing of any surgery. So stress is going to lead to that. So if you can really take as much time out of work as you can, and I'll talk a little bit about that later on. You really want to be dedicated to your home exercise program and attending your physical therapy prescribed visits. You want to make sure that you're here for every visit. You want to make sure that you're intent and you follow with everything that your physical therapist asks you to do. Don't be afraid to ask why. The last factor that I really feel is whatever past injuries that you've had and whatever your expectations are. I find that people have had other injuries in the past, or people that have had other surgical interventions know that there's going to be a moderate amount of discomfort, and they can really work a little bit harder and work through that, knowing that the pain is going to be there. The more willing you are to be uncomfortable, the better your outcome is going to be. The next part of having a successful recovery is, again, your surgeon. You want to pick an orthopedic surgeon that has a proven track record. Very important. Your frequency, and some things you could ask the surgeon about are, what is their frequency of the surgery that's completed? Again, ask to see the statistics for the success. The frequency of continuing education that they are completing on a regular basis. And the surgeon's quest for personal growth is very important as well. And maybe check to see if the surgeon is also a teacher. The next part is the prehab. I suggest, through my eyes, 4 to 6 weeks of intense physical therapy prior to the surgery. The reasons for this are as follows. We want to make sure that your range of motion is completely full range of motion with no limitations, if at all possible, moving in every direction that we can, because whatever surgery you have going into it is what surgery you're going to have coming out. How important is that? Super important. We want to work on decreasing the swelling in the joint. We also want to maximize the strength in the joint. The muscles around it are also going to play a part, where they're going to compensate a little bit, and other muscles might overpower, like your upper trapezius might overpower the rotator cuff, and other muscles aren't going to work as well. We also want to learn the do's and the don'ts. What should I do before surgery? What should I do after surgery? What should I stay away from before surgery? What should I stay away from after surgery? And you also want to get over the latent muscle soreness of new exercises. Very, very, very important. As we talked about before the last couple of times, again, I'm really big into the mindset piece. When we're going to have the rotator cuff repair, we really want to have a strong what. Hi, Tracy, how's it going? We really want to have a strong what, which is our outcome. What are we looking to do? We're looking to have full recovery in 3 months, 6 months, 9 months. And our why. Why is it important that we need to do this? So we need to find a purpose. Because whenever we get kind of tired and we're thinking, oh, well, I don't really want to go to the gym, or I don't really want to do these exercises tonight, having a strong why with your mindset is going to help you focus on the prize, which is full recovery. And we're going to come up with a massive action, how we're going to complete all these things. And that's something you can talk to your physical therapist about, to find all the steps that you need to take to be able to have a successful recovery. So now I'm going to break down the 3 different periods of recovery of a rotator cuff repair. The first one, and I'm actually going to go into the body perspective and the mind perspective for each of the different pieces. The first one is going to be 0 to 6 weeks. 0 to 6 weeks, the goals from a body perspective or a physical perspective are to, number one, we want to protect the graft. If we do have a rotator cuff tear and the pieces come off and the pieces come off, they're actually going to sew the pieces back down. Now, when I say, like, if we were to have a piece of braided rope that kind of intertwine it a little bit, and what we, as during the healing process, it's a very fragile piece. If we have any tension on it, it can pull apart. So if we have tension on it, you can see a couple pieces can come back apart. So we want to make sure that that does not happen. So by protecting the graft, we want to do no active range of motion. We want to do, there will be no reaching out to the side, really no arm motion in which your elbow comes away from your side. So everything, we're going to kind of be more in the protective phase, especially for the first 0 to 4 weeks. We also want to protect, and we want to decrease the inflammation or decrease the pain in the area. We want to increase passive range of motion. Passive range of motion means that the physical therapist will be doing a range where you're being passive and your arm is just relaxing. So we're going to take care of making sure that your arm moves up straight to the straight motion, out to the side motion, and also the rotation motions, certainly within the parameters of the physician. We want to have a normalized arm swing. So when we're walking, we want to make sure that our arm is relaxed as long as you're out of the sling. And we really want to start to address, like we've talked about many times in the past, about the fuse box. The fuse box is when we want to make sure that all the muscles along the whole spine, all the way down the front, your neck muscles, your abdominal muscles are very well are worked, as well as the low back, as well as your glutes, making sure every muscle along your spine is really worked. Again, no reaching, no active motion. From a mind perspective, I know this is really challenging for some of you, but we need to rest. Very, very important. Resting is a very important piece that I know can be really challenging for some people. We also want to really attend the physical therapy, so it's crucial. Whatever setup that your physical therapist has you working on, we want to make sure that you're attending the physical therapy. If it's 2 times a week or 3 times a week, we want to make sure that you do that. You must do your home exercise program. It's non-negotiable. If you want to have a good outcome, you got to do it. Again, what you put in is what you get out. And we want to stay focused on the prize. We want to stay focused on our outcome. We want to make sure that we're going to hit our mark, making sure that we do all the things that I just talked about. So, in the first phase, rest. We're going to have no reaching, no lifting, and very important to let your body recover properly is hydration, nutrition, light mobility, and light exercise, because we want to stay active. Yes, Devin, even at 4 a.m., even when there might be a deer coming out in the road. And one of my favorites is motion is lotion. We want to just keep the body moving. The second phase is we're going to talk about is week 6 to 12. From a body perspective, the goals are still we want to protect the graft. Posture, sit down nice and tall, chest up, chin in a good position, shoulder blades in a good position. We want to start to increase the motion, passive range of motion that the therapist is going to be working. The therapist is going to be stretching you. We want to start to move to active range of motion, and when we can start to do active reaching, we can reach forward. We're going to start to initiate some reaching out to the side motion. And during that time from 6 to 12 weeks, we want to initiate some rotator cuff strengthening. The rotator cuff are the 4 muscles that I talked about before. We want to continue to work on the fuse box. We want to continue to work on the core and the abdominal and the low back muscles and the neck muscles. And then we want to start to improve function to work everything below shoulder. So we want to be able to do things that we feel like we can reach and anything we can handle below shoulder. During week 6 to 12, now we talk about the mindset piece. Again, rest is a must. We still need to rest. We want to work hard, but we also want to rest hard. Again, physical therapy at this point is going to be picking up and balance. It's kind of fine-tuning things a little bit. Again, making sure you stay committed to staying with the physical therapy at this point, because this is when people, if they do have a tear, they could re-tear it again. Not very common, but it is something we want to be aware of. And this is when it can start to be frustrating. We can start to get frustrated because we're not seeing as much progress as we did initially, but this is when you really want to stay the course. Being in a good state, being in a good state of mind is really important. The next piece is from 3 to 6 months. Our body perspective, or the physical perspective, or the goals are, we still want to protect the graft. We still want to work on our posture. We should have well into normal range of motion, passive range of motion. We should have pretty much normal active range of motion when you're lifting it up yourself. And we want to just continue to do the rotator cuff strengthening exercises. And now we want to start to improve at an above shoulder function. The mindset piece, again, very important at this point. Rest is a must. Attending physical therapy is a must, picking up more imbalances. And again, this process can be kind of a little slow progress. So we want to really stay focused on the prize. Just some questions. And the other thing would be is, how long would you be out of work for? Hey, Jan, how's it going? Thanks for joining. And hi, Nancy, welcome back again. So out of work, you really want to stay out of work as long as you possibly can. I'm going to say I recommend at least a month, and then you want to start to work in light duty if you can. The reason why I say a month is because, like I talked about a few minutes ago, when we're at work or stressed with life or stressed with your family or kids or whatever's going on in your life, that takes away from the body's ability to heal really well. Because when we're stressed, we don't sleep. When we're stressed, things don't go well. So we want to really make sure that you're making it a really point to cut all the stresses out. So if you can when someone takes 2 weeks out of work, they struggle. 3 weeks, they do a little bit better. When they take a month out of work or a month to 6 weeks, the progress is dramatically different. That's just from my experience and through my eyes as a physical therapist. So here are just some things, kind of what to expect. Significant pain for the first couple of days. You're going to need to sleep and rest a lot, probably a lot more than you have in a long period of time. You want to exercise 3 to 5 times per day. You're not going to be able to drive for 3 to 4 weeks or sometimes 4 to 6 weeks, depending on the physician's orders. No active reaching for 4 to 6 weeks. And you're not going to feel like you're kind of back to normal till about the 12-week time period. You can have pain for up to a year after your surgery date, and there is an increased re-tear rate if you don't really follow the program. And you really want to continue, it's crucial, continue with your home exercise program for the long haul. So what are some physical therapy exercises that I might do as a physical therapist? As you know, I'm big into the fuse box. That's my thing because I really believe that everything is related to making sure you have an active core. So fuse box, core exercise is crucial. Working your mid-back, which is your thoracic spine, making that a mobile piece. And if that happens to move well, your thoracic spine is responsible for 28% of your shoulder motion. So if your mid-back moves well, likelihood your shoulder is going to move good as well. I'm also going to treat the cervical spine. I'm going to make sure that all the nerves are being turned on, that there's nothing going on with the spine that can affect the shoulder, range of motion or the shoulder strength. And I'm really going to make the changes. So I'm going to probably do some mobilization of the spine, but really work on the spine. That's what I'm going to do hands-on. And I'm going to depend on making corrections for how the shoulder and how the elbow and the wrist move through exercise activation by different movement patterns. And again, how are we going to be successful? We want to create a winning mindset. We want to create, in order to reach your goals, you want to have a winning mindset, which is mindset fitness, which is you want to get in a good state going through this process, because there are going to be times that you're not really going to feel so good. There's going to be times that you're not going to sleep. There's going to be times you're going to be aggravated. There's going to be times you're going to be in pain. And as long as we can keep a good mindset piece, you're going to have a much smoother road to recovery. So now I have a couple questions, and feel free, anybody, to type in with some questions. And also I wanted to say is, if anyone has any topics that they'd like to hear more about, they have any questions or thoughts or ideas, I'm more than open to take any topics that someone would like to hear about, just from the patient perspective. So here's a few questions, and thank you again for writing in. I had rotator cuff surgery 2 months ago. When will I be able to play golf? That's a really good question. I would say it depends on a few things. It depends on the size of your tear. It depends on your ability to recover. It depends on what you put into it. But let's just say you had a good surgeon. You really put in the 4 to 6 weeks of prehab. You've listened to everything that the physical therapist has said, and you're doing really, really well. You're probably at a point where you could start to do some light putting and some light chipping at this point. But I'm going to say you're not going to be able to really swing a golf club anywhere between 3 and 6 months, depending on what your physician says and their precautions, and depending on just how you're doing. So I would say the 3 to 6 month time frame. It's a great question. Next one is, I am an accountant. My surgeon told me that I can go back to work 2 weeks after my surgery. What are your thoughts? Kind of like I just had said before, I recommend at least 4 to 6 weeks off after rotator cuff surgery, because I see the patient and how they struggle when they go back to work too early. They get pulled away, mentally they get pulled away, so it takes away from the healing of the shoulder, or any surgery for that fact. Also, what I'm seeing is that, well, I didn't have time to do my exercises. I was too tired when I got home from work, and they have come up with all these different excuses. They're not making this a must, and it has to be a must. This is a really, really tough surgery. It can be really, really painful surgery. So you really have to optimize everything you can to have a great recovery. So I don't think 2 weeks is enough, not even close. Great question, though. Next question. Over the winter, I had left rotator cuff surgery. I was doing very well until the last snowstorm that we had in April, and I fell hard on my left shoulder. I'm scared to go see my doctor. What should I do? I'm going to assume a few things. I'm going to assume that you're writing this question because you're still having a lot of pain, or your symptoms have gotten a lot worse, or you've had a pop in your shoulder, or there's something going on that it's not the same as it was before the surgery. I'm going to say you really want to just go see your physician, because we can get a traumatic fall on the shoulder can cause a rotator cuff tear. And when someone has a rotator cuff tear and the fibers, the longer you wait afterwards, the fibers kind of retract up into the joint, and sometimes they're not repairable again. So I would definitely go see a physician. Have your physical therapist check it out if you're still going. If not, I'd definitely go see a physician and see what your physician says, because that would really be crucial to make sure that we're doing everything we can. Because if you need to have something repaired, then you just want to get it taken care of. Great, that's a great question, though. The next question is, I had rotator cuff surgery for a small tear, and I'm still having some pain that I was having before surgery, and my progress is limited. I'm doing my exercises faithfully every day. I have not missed an appointment. I'm very frustrated. What should I do? First thing I would do is I'd definitely talk to your physical therapist to see what their thoughts are. I would definitely, obviously, bring it up with your physician. Through my eyes, I guess what I would take a peek at is I would take a look at the cervical spine. A lot of times, the cervical spine, there's 7 vertebrae in your neck, and the cervical spine, the vertebrae in your neck, are related to different parts of the joint. So if you're not getting better, even though you did have a rotator cuff tear, there's a piece in here that I would definitely say that needs to be addressed. The neck needs to be addressed. I'd almost say that that would be more important than just even starting with the rotator cuff. Whenever someone comes in for a shoulder surgery or shoulder issue or pretty much anything, I'm always checking out the neck. I'm going to see how much better I can get the neck, and then I'm going to deal with what's left afterwards. So I would say I would have them check out your neck, because that might just be the missing piece. That's a great question, though. I've been told that I have a rotator cuff tear. I have not had surgery yet. I have noticed that when I wake up in the morning, my arm is the sorest. Why would it be the sorest in the morning after resting it all night? That is a really, really good question. I'm going to kind of piggyback to the last question that the person wrote in for. One of the things, if someone wakes up in the morning and they're sleeping really well, or even if they're not sleeping well, and they wake up with more pain in the morning, I'm looking at the sleeping position. I'm looking at the sleeping position. How is the shoulder rested? Is it on a pillow? Hopefully nobody sleeps on their stomach. That's not a good idea. Is their arm across the body? I'm trying to figure out, what are you doing throughout the night, maybe that might be causing some of your symptoms. I would look at the position of your neck. I would look at the position to make sure that your neck isn't forward. because I know from some of my other talks related to the fuse box, if your head is in the fetal position, we can be pinching the nerve, which can give you significant pain anywhere in your upper body or into your lower body. So I would look at the neck position of your pillow. I look at the position of your body. Are you sleeping with a pillow between your knees? Are you turned? Are you rotated? Are you sleeping on your back? Are you sleeping outside? So I'd definitely be checking out those positions. I would also be checking out your neck, because I think it sounds like, just from what I'm reading here, that definitely some of your symptoms are coming from your neck. So I'd have your physical therapist and maybe your physician just take a peek at that. Great question. I had rotator cuff surgery on my left shoulder, and my right shoulder is bothering me. Will this happen on my right shoulder? It's definitely something that's possible that can happen on your opposite shoulder. One of the things that I look at is that just because you have your rotator cuff repaired, and if you haven't addressed any neck issues, that there's still going to be weakness going on in your shoulder, you could re-tear it. So I would say make sure you're doing your postural exercises, make sure you're doing your upper back strengthening exercises, making sure you're staying as active as you can. Motion is lotion. Again, addressing your posture, super important, and hopefully it won't happen on the other side. I'd also be looking to see if you have any imbalances left to right, and how can those be addressed. Again, thank you very much for the question. Great question. So hopefully after this, you guys are ready to win the day on your road to a really good rotator cuff surgery recovery. Again, my name is Todd Thoughton here from Thoughton Physical Therapy. It's been a pleasure to share this information with you. And please feel free to contact me at toddh@thoughtonphysicaltherapy.com or private message me as well. I just want to add more value and give you more information. And tune in for next week's topic. I'm excited to be back here again for week number 16. Hope you guys have a great week. Thanks.